There are concerns that cuts to Tasmania's health budget could result in patient deaths. Leaked documents this week revealed there will be cuts to frontline health services across the state. More documents revealed today show more than 100 mental health patients will be left without case managers. The hospital system is already working at levels which are well above a level considered safe, and a health policy analyst has described how the budget cuts will affect patient care and could result in deaths. His comments have added to calls for a federal takeover of Tasmania's hospital system, as Tamara Glumac reports.
Hobart dentist Michael Young is lucky to be alive. The 83-year-old was taken by ambulance to the Royal Hobart Hospital's emergency department last month after collapsing at home with severe lower back pain. He says he waited for 5 hours before being seen and was then rushed to theatre after being diagnosed with an aortic aneurysm, life-threatening swelling of the large artery that supplies blood from the heart to the rest of the body.
It's a ridiculous situation that anybody at my age particularly should be left for 5 hours without any treatment whatsoever. And although it may not have been known at the time that I had a life-threatening situation going on, I was in extreme pain and asking for pain relief, and none was given.
Surgery was a success and Dr Young has made a full recovery.
I'm very grateful to the professionals who took over my case, but frankly, the rest of the business was completely unprofessional, I think.
He's written to the state's Health Complaints Commissioner, describing his experience in emergency as hell and calling for a review of procedures.
If it had gone the wrong way and I'd died, I would have just been a statistic and nothing would have been known about it whatsoever.
A system already struggling to cope is about to come under even more pressure with multi-million-dollar budget cuts. Tasmania's public hospitals have already been operating at nearly 100% capacity, 15% above what's clinically recommended as safe. Documents leaked to 7:30 Tasmania reveal for the first time that frontline jobs will go and there are risks to patients and staff. The documents list cost-cutting measures for mental health services in the south, including shedding nursing jobs, case managers and psychologists. Waiting lists could get longer, hospital admissions increase and mental health clients are at risk of losing their case managers. The documents also warn of an increased staff workload with consequences for patient care and the potential for serious incidents. Other budget documents show $38.5 million will be cut from the Royal Hobart Hospital, $16 million from the Launceston General Hospital and $11 million from the North West Regional. Primary health services like community health centres stand to lose $8.6 million, while $7 million must be shed from mental health.
There is absolutely no doubt that lives are at risk, that people will not receive vital health services that they require, and they will ultimately die waiting for those health services.
Tasmanians will have a poorer state of health, and it will take years and years and years to catch up.
Taking $100 million out of a health system that's already absolutely strapped and working over budget will really have some dire consequences for patient outcomes.
A progress report on the budget savings lists cost-cutting measures. They include rolling back unfunded staff increases over the past 3 years, which have cost more than $25 million, using fewer locum doctors and nurses and cutting staff overtime is expected to deliver around $3 million in savings. A plan to stop low-value clinical interventions would save $11 million.
I only hope that they've asked a clinician if those things are of no clinical value. I mean, the last thing we want is the bureaucracy saying, in our opinion, we shouldn't do this anymore.
That is an unbelievably peculiar situation where, in fact, it looks like now that people will be denied services simply because there is no value associated with that.
Changes to the way the state's pathology and radiology are run are also under consideration. Health policy analyst Martin Goddard believes the budget cuts show Tasmania, more than any other state, cannot afford to run its own health system. He says the state should be talking to the federal government now about a long-term Commonwealth takeover of Tasmania's public hospitals.
Unless that happens, we will not be able to afford our system. It will fall apart. There'll be a lot of dead Tasmanians who otherwise would be alive.
According to Goddard, the financial future for health is even bleaker.
The most recent intergenerational report put out by the Federal Treasury showed that by 2040, the amount of money that the states were going to have to spend on their health systems was going to equal their total revenue.
He says Tasmania is lacking a clear health plan.
The consequences of getting health policy wrong always are that people die. That's the bottom line. People die, people get sick, people stay sick. The cost of getting things wrong, of not doing things properly, not giving adequate service, is always measured in human misery.
The Australian Nursing Federation has long been pushing the state government to reduce inefficiencies within the health system. Earlier this year, nurses issued the health department with a list of cost-cutting measures, including putting stable patients up in hotels, reducing equipment waste and reviewing doctors' use of luxury cars. The union's State Secretary, NEROLI ELLIS, says those savings are a better alternative to cutting jobs.
There is absolutely no fat in this system to actually try and trim off anything in the hospital and frontline services.
She says nurses are already working double shifts and pressure on emergency departments and elective surgery is growing.
We're seeing crisis situations in our emergency department with a huge demand. It's very hard for nurses to cope with patients who've been there up to 2 days on trolleys waiting for beds.
The Australian Medical Association is also concerned.
Despite the government committing to all sorts of Australian standards with respect to healthcare, particularly in emergency rooms, and with elective waiting lists, that they're just going to allow them to blow out further and further because they're in a financial mess.
Uncertainty about exactly what will be cut is impacting on morale within hospitals.
We've got young doctors in training in our public hospitals who are hearing all sorts of rumours about job losses, loss of consultant contact, and that means the whole process starts to implode. You've got low morale. If these things are true, we've got less doctors being trained.
Unions say the government's failing to meet a basic responsibility.
It's cowardly that the government is hiding behind the bureaucrats and allowing them to make what are essentially service delivery and policy decisions on behalf of the government. The state government has made a calculated decision to reduce health services to Tasmanians. There is no way known that the state government can continue to make statements that the patient will be at the centre of what they do, when in fact they are going to compromise the care that is able to be provided.
Tasmanians have a right to high quality healthcare, and it's the job of this government to deliver high quality healthcare.
7:30 Tasmania did approach the government for an interview, but the Health Minister, Michelle O'Byrne, has not made herself available. A number of people we have spoken to say Ms O'Byrne has been sidelined in the health agenda and that former Health Minister, now Premier Lara Giddings, has taken carriage of it.